Hello, my name is Jacob Molyneux. I'm a social media editor and a senior editor at the American Journal of Nursing. A brief word of thanks to the conference organizers and to those at Wolters Kluwer, our parent company, who asked me to come speak to you today. This is outside my usual territory. I stay in the foxhole of an editor much of the time. 5 years ago, I started a blog for AJN. Shortly after that year, we added a Twitter account and a Facebook account. These are three fairly basic social media areas. We did all of this from the perspective of editors and content people and writers, rather than SEO wizards planning to game the system. Our approach, so what I'm going to cover today, at any rate, is what we've learned in those 5 years and how I believe it's helped keep AJN an essential resource for nurses and academics. There are clear benefits of using social media that we've found. Some of them are measurable, and others I believe we can infer. Rather than diluting the quality that drives AJN content, and the editorial values that have made us what we are, we let those editorial values guide the way we use social media. A crucial distinction for us. I think a lot of you know a lot more about the scholarly publishing context right now than I do in terms of the movement towards an atomization of content from a subscription model, the diminished influence of professional organizations, especially, for example, among younger nurses, the diminished influence of press releases. I rarely open them, I must admit. So how do we get our content out there? How do we reach nurses? Kathy Wolf, our CEO, pointed out this morning that nurses are getting information about their jobs from social media. There are 3 million nurses in the United States alone. So this is a big audience. I think I need to say a little bit about AJN as a journal to contextualize why we use social media and why it's a particularly good fit for us. AJN is a peer-reviewed, evidence-based journal. It's 115 years old next year. It started in 1900. So it's a legacy journal, so to speak. As you know, you can't rest on your laurels in most businesses today. We are a kind of hybrid journal in that our content is broad-based. We publish everything from original research to news to policy to personal essays to ethics discussions. Our audience is likewise broad-based. It ranges from nursing students to PhD students to scholars to academics to journalists and beyond. We try to avoid jargon in the way we write. We edit vigorously and for clarity and accessibility with no dumbing down of the content. So this is not always typical of, well, at any rate, I will say that much. We have a global reach, an increasingly global reach. AJN Online is our journal's website, and up to 25% of the people who are now visiting our journal are international. With a single use of social media and the several ways that it has served our content, let's just say, in ways that traditional print publishing or even traditional online journal publishing can't so easily do. Back in early August, you may recall, especially if you were in the United States, there was a lot of misinformation about the Ebola virus traveling. The media was actually, supposedly responsible sources were actually stoking this. They said, be afraid. Some people said that it was going to become airborne shortly rather than bloodborne. we needed to close our southern borders. So there was misinformation, and this was among nurses and the general population. Our clinical editor is an epidemiologist. She wrote a blog post called, well, the title is up there at the top, and it simply put the situation in perspective. It said, this is what we know about transmission of blood-borne viruses. This is how you do isolation. This is why it's probably not going to become an airborne virus. And so she brought a little sanity. And by doing so, she did one of the things you can do on social media, which is to add value to breaking news, new research, policy, public health issues. You can add value, and you can also refer back to your own content. So we had published an article on Ebola several years before. We linked to it in the blog post. A number of people went to it. We put links to the blog post on our Facebook page and on Twitter. There, another thing happened, which was user engagement. There were a great deal of comments. There was a great deal of sharing by these users across platforms. And another thing that this blog post allowed us to do, or social media allows us to do, is to be nimble. You can respond more immediately to changes. The world is changing fast. Even the publishing world is changing relatively fast. And it's important to be able to respond in a timely manner to things. So it allowed nimbleness. Lastly, it allowed us to reach journalists, to make connections. So a U.S. News report, U.S. News and World Report, editor or writer, I'm not actually sure who read the blog post, but apparently it was the blog post they read. And having read it, they got in touch with Betsy. They interviewed her extensively for an article on isolation procedures, quoted her extensively, and extended our reach to millions of people. So this is an example of how one thing on social media can have a lot of effects. There are a number of other things that social media has done for AJN. It helps us make connections. Twitter is particularly good for this, as a lot of you know. A lot of influential people are on Twitter. It's a great place to get information and to trade information with journalists, academics, scholars, activists, patients, all manner of people. So we found a contributing editor via social media. We found one of our columnists. We have done calls for submissions, some of which have netted excellent submissions. We've increased our global reach. If you look at our blog statistics, people are coming from all over the world to read the blog. And one last thing that, before I talk about this last slide briefly, is that social media allows us to do something that a lot of you may not have a lot of a respect for if you're in the hard sciences, which is storytelling. Now, storytelling seems like a soft thing, but increasingly in nursing and medical theory in particular, story, patient experience, clinician experience, is seen as a meaningful source of knowledge, clinical knowledge, that has application. So on the blog, we publish patient and clinician stories. And sometimes those stories are lead-ins to content that we have published, the clinical articles that we published in the journal. So that links back to our content. It engages people. They feel heard. These are not sanitized stories. These are not PR versions. These are real experiences that people share. I edit everything on the blog, but so they're edited, but they're not cleaned up in any ways. So another thing that you can do with story is humanize articles that you have. So many AJN editors have written blog posts at various times drawing on their own lives, the lives of their family members, their own experiences as clinicians if they're nurses, and again, putting into context something that we've covered in the journal and making it clear why there's a human relevance. And this drives traffic to our content, and it engages users. And it also says AJN is concerned, it's an authentic voice, it's a reliable voice, and it's worth visiting. I've gone on probably too long already, so let's just talk about this slide briefly. We publish 2 continuing education feature articles every month in the journal. These are research, substantive clinical pieces. Each one also has a CE test. You can get continuing education credit through it. Every Monday on our Facebook page, we take a question of the week, a CE question of the week from a former CE article, and we post it. We get hundreds of responses. We get a lot of engagement. And a certain number of these people go to the articles. So, and the top one, that article was published in 2013. We put the CE question on a year later on our Facebook page, and that's what happened to the traffic on AJN Online that day. Now, what's not reflected here are our statistics on the Ovid medical database, where you can also get AJN articles. The statistics on Ovid, which actually came to me too late to put into this slide deck, are much higher on the same date. So the bottom graph, similar story. We have the lower spike is a CE question of the week for this article on sustaining pressure ulcer best practices, a big issue actually in hospitals. And the larger spike on the 8th of August is from a blog post that the senior editor, my colleague, wrote, contextualizing the article and saying, why does this matter? Why do you need to know this stuff? And what are the implications? And so that's the kind of traffic that we got. I think I should probably stop there. There's an awful lot more I could say about social media. I don't think I've really given you a full glimpse of what we do. And of course, there's the question of the time investment and the costs. But I think some of this is going to come up in the panel discussion. So thanks very much.